So we're going to go over cardiac blood flow, and this is something that you definitely need to know. Okay, so terrible drawer. We already know that about myself, right? So when I look at the heart, I make a box. Okay, we break it into our four. So we have our right atria, left atria, right ventricle, left ventricle. Okay, the atria, okay, they're our receiving chamber, and then our ventricles. These are our pumps. Okay? So the job of the atria is to receive blood. The ventricle's job is to pump blood. We're going to talk about this in a second. So if we divide the heart like this, the right side of the heart is going to have deoxygenated blood. Okay? And the left side is going to have oxygenated blood. This is important to recognize. So deoxygenated blood is going to return from the body. So after all of the cells have done their job, they've picked up the waste product. So we have that CO2, right, the major waste product of metabolism, returning on the red blood cells back to the heart. So it's going to come into the right atria, it's going to pass into the right ventricle, and then it's going to pump the deoxygenated blood to the lungs. Okay? The lungs is we're going to exhale, we're going to off gas that CO2, take a nice inhalation, good tidal volume breath, and we're going to pick up oxygen. It's going to hop onto the hemoglobin, the red blood cells. We're going to have our pulmonary respiration, and we're going to have a return of oxygenation to the left atria. So this side is going to receive the oxygenated blood. It's going to pass to the left ventricle, and then this left ventricle is going to pump blood into systemic circulation. So that's how the body is going to get its oxygen supply. So when we start to look at this, okay, and we follow this blood flow, blood is going to return to the right atria, right? So we know that when we kind of back up a second, we have arteries, and they're always going to carry blood away from the heart. Okay? A for artery, A for away. That's going to be 100% of the time. Arteries always carry blood away from the heart. Our veins, they're going to carry blood toward the heart. These are always. Okay? Most of the time our arteries are going to carry oxygenated blood and our veins are going to carry deoxygenated blood. When we start talking about our cardiac blood flow, this is where we're going to have an exception, right? It wouldn't be EMS if we didn't have some type of exception. All the time except, right? We're kind of used to that now. So this is universal. Every artery is going to carry blood away from the heart. Every vein is going to carry blood toward the heart. Most of the time, arteries are going to carry oxygenated blood because they're going to be leaving the left side and through our systemic circulation. Veins, we're going to carry blood back toward the heart, and it's going to be on the right side, which is going to be our deoxygenation. Okay? So we're going to talk about this exception that we have. So, blood is going to return to the right atria through the inferior and superior vena cava. This is not drawn to scale. This is just to help wrap our head around a concept, right? So blood's going to return through the inferior and the superior vena cava, and that blood's going to return to the heart, and it's going to dump into this right atria, okay, deoxygenated blood. It's going to pass through a valve, which we're going to talk about in a second, and then it's going to go to this right ventricle. The right ventricle is going to pump blood, and it's going to come over to the lungs. Again, not drawn to scale. We understand there'd be a lung here and here. For our purposes, right, it's going to over to the lungs. Okay? Now, this is where it's going to pass through, as we start to go through. When we're leaving, it's going to be an artery, and it's going towards the pulmonary system. So this is going to be the pulmonic artery. It's carrying blood away from the heart. This is our exception. So our pulmonary artery is going to have deoxygenated blood. Okay? Deoxygenated blood. Our pulmonary vein is going to carry oxygenated blood. Pulmonary artery, deoxygenated blood. Pulmonary vein, oxygenated. This is that exception. Most of the time arteries carry oxygenated blood and veins carry deoxygenated. Okay? So the vein, the artery that's going to take the blood from the right side of the heart to the pulmonary system over to the lungs to get oxygenated, that's going to carry deoxygenated blood. We're going to have our exchange of gases, pulmonary respiration, right? And now we're going to have the pulmonary vein take this oxygenated blood and carry it towards the heart, and it's going to dump oxygenated blood into the left atrium. Okay? Going to pass through this valve, and then it's going to go to the left ventricle. Left ventricle is going to pump oxygenated blood through the superior and inferior aorta, so the ascending and descending aorta, and it's going to go into systemic circulation. Okay? So we're going to kind of build on this. As we start to look at this, we have different types of valves. And the valves, their job is to prevent backflow. So if I have blood coming in this way, I don't want it to back up. I want it to go to the right ventricle. I don't want my blood in the right ventricle to go back up into the right atria. Right? Blood should continue in this circular motion. We want to keep it going in the same direction. Once we start having backups and problems, that's where we start seeing things like JVD and stuff like that. Okay? We're going to talk about that in a minute. So when we look here, okay, an easy mnemonic to remember the valves. Okay, TPMA, and this is going to be the first letter of each of these valves, and it's going to stand for toilet paper my assets. Okay, easy way to remember the vein. So as we start to go through here, this first valve, these valves between the right atria and the right ventricle and the left atria and the ventricle. So we have these valves between the atria and the ventricle. So medical world, we like to be like really creative. So these are going to be atrioventricular valves. Okay, so we're going to refer to them as AV valves. The ventricles are going to pump to a system. So they're going to, and they have a special shape. They look like little crescent moons. So they're going to be semilunar. So they're called semilunar valves. So semilunar valves, this is going to be the right ventricle is going to pump to the pulmonary. So it's going to be the pulmonic valve. Okay? And then our other one is the left ventricle is going to pump through to the aorta, the ascending and descending, and it's going to go through the aortic valve. Okay? Now our AV valves, so this one right here, between the right atria and the right ventricle, this is going to be our tricuspid, okay, tri for three. When you look at the shape of it, it's three-pronged. So this is going to be our tricuspid, right? And then we have M. M is going to be for our mitral. It's also known as the bicuspid. So this is, if you've ever seen the Pope and the Pope's hat, kind of, I'm terrible at red, it's kind of something like that. It's got a little cross on it, right? That's the shape of the bicuspid valve. His hat is called a mitra. There you go, a little history, religion for you, right? So that's the shape that we're looking at. So this mitral valve is over here. So when we kind of follow this blood flow, blood is going to enter through the inferior and superior vena cava. It's going to go into the right atria. It's going to pass through the tricuspid valve. It's going to go into the right ventricle. From the right ventricle is going to pump over to the lungs, so it's going to go through the pulmonic valve, and it's going to enter into the pulmonary artery, and that deoxygenated blood is going to come over to the lungs. The lungs, we're going to have pulmonary respiration. We're going to pick up oxygenated blood. The oxygenated blood is going to return to the left atria through the pulmonary vein, carrying oxygenated blood. Dump into the left atria. It's going to pass through the mitral, or bicuspid, same name, same thing, right? Valve into the left ventricle. The left ventricle, this is the workhorse of the heart. So this is going to pump oxygenated blood all the way to the tips of our toes, to the top of the head, out to our distal phalanges. So this has to be able to circulate blood to every cell in the body. So this is the big workhorse of the heart. And this is going to pump to the ascending and descending aorta, and it's going to pass through the aortic valve. Okay? So this is how a normal, healthy heart looks, and this is how it functions and pumps. Right side is always going to be our deoxygenated blood. Left side is going to be our oxygenated. Atria is always going to be our receiving chambers. Ventricles are going to be the pumps. The left ventricle is the big workhorse of the heart. And this is why, when we have individuals who, when we talk about our congestive heart failure, right, so our CHF, these patients, we start to talk about right-sided and left-sided heart failure. If we have a patient who has right-sided heart failure, when we start to look at our symptoms, right? Our symptoms for right-sided we're going to see, JVD, we're going to see ascites, we're going to see pedal edema. So if we kind of follow this flow and we kind of see what happens when it backs up. So if blood starts to kind of go backwards through the right ventricle, it goes back up into the right atria. Well, now we have blood pumping into the right atria, and we have blood coming back up through here. So now we're going to kind of cause this to start to backflow this way, and it's going to come back through our superior vena cava. It's going to engorge the external jugular vein. So our JVD, jugular vein distension, they become engorged because of this backflow. We now have blood coming in this way, so we're engorging those veins, and that's one of the signs of that right-sided heart failure, because it's backing up. Okay? The ascites is because as it starts to back up through that inferior vena cava, that's where we're going to start to have this ascites. We're going to have that swelling of the liver, the spleen. They're going to look like they're pregnant. They're going to have a rigid, distended abdomen. When you push on it, it's going to be hard. That's that ascites. And then the pedal edema, if they're standing or sitting, you're going to see it in their ankles and their feet. If they're laying supine, if they're confined to bed, you're going to see it in their sacrum. We're going to have that edema start to swell. So they're going to have dependent edema. Okay? If we have a patient with left-sided heart failure, right? So left-sided, our symptoms are going to be that pulmonary edema. So this is where we listen to the patient, we listen to lung sounds, we hear rales. They're starting to have fluid fill up the alveoli. So what happens with the left-sided is, same thing. It starts to go in the wrong direction. It's going to start to back up. So, if we kind of just look at this diagram, if we follow this backwards, well, we know that now we're pushing fluid, we're pushing this backflow back into the lungs. So now we have flow coming this way and this way. We're going to increase the pressure. So now the pressure is going to start to force the fluid, that hydrostatic pressure, is going to start to leak out. So when we have that plasma that starts to leak out through this vasculature, it's going to go into that interstitial space. It's going to start to fill up the alveoli. So this is where we get those rales. We hear that fluid, that crackling in the lungs. Okay? So when we're starting to kind of look at it, we're trying to figure out, based off the symptomology, what our patients might be having. If we hear rales and we see that they're kind of hypertensive, well, that makes sense because we're increasing that systemic vascular resistance. So now they're trying to fight against this. So this is where we see, eventually, whether you start with right-sided or you start with left-sided, this is where eventually the other side of the heart's going to try to compensate for as long as it can. When we have someone with the heart, if you go to the gym and you work out, right, so you want big biceps, you do lots of curls, right, what happens is your muscles start to grow. We call it hypertrophy, right? So the muscles get bigger and bigger. The heart, when it works hard, it's a muscle too. The problem is when it builds its muscles and it gets big, it builds on the inside. So it stacks it inside like this. So now we have less room for this fluid, for this blood, right? So this is what happens, and this is why it's called congestive heart failure, because it's creating this congestion, this backup. So now there's less room, so it can receive less fluid. So now the same amount of fluid is trying to, blood is trying to flow into this ventricle, and it's not able to receive it. So now it's not able to do the same job, and this is what happens. So this is what we're talking about. If it happens on the right side, then it happens over here. Eventually, over time, this is going to progress. Congestive heart failure is a chronic illness. Anytime we have a chronic illness, this is where it's progressive, and eventually is going to lead to death. So this progression, if it starts on the right, it's going to eventually hit the left, and if it starts on the left, it'll eventually hit the right. When we have the two together, that's where we have what we call total heart failure. Okay? Total heart failure. Now this could be an indication where now we show up and we have a patient who might be in cardiogenic shock, or this puts them at greater risk for developing an MI. We have pump failure. So now you show up, once this whole thing has failed, well, now we may find that our patient's hypotensive, right? They're becoming bradycardic, and now we have cardiogenic shock on top of it, okay? So this is kind of that overview. You definitely have to know your blood flow. This should help kind of sort some things out. Congestive heart failure, this can be one of those things, trying to discern between right-sided and left-sided can be challenging. So hopefully this little diagram, I know it's a terrible drawing, scratches everywhere, but hopefully this helps at least wrap our heads around this concept, okay? This is stuff we're going to be going in depth in our cardiac lecture, but this should be a pretty good overview. Make sure that you understand this stuff, okay? Good job.